Okay, good afternoon and welcome to this hybrid meeting of the Grant Subcommittee of the Policy and Resources Committee. I would remind all attendees that the meeting is being recorded and webcast live on the Council's YouTube channel. I've agreed the attendance of some members remotely and would remind all remote attendees to mute their microphones when not speaking. For any members of the public watching, please know that all public committee reports, including details of specific recommendations, are available on the Council's website. We'll start with item 1, apologies and substitutions.
Thanks, Convener. We have apologies for Councillor Louise Nicol, with Councillor Ian Gall attending as substitute.
Okay, thanks for that. And declarations of interest and statements of transparency. Okay, I'm not seeing any there. Okay, so we'll just progress on to the one paper today. It's item 3, Digital Lifelines, Phase 3, Digital Inclusion, Kindness and Compassion in Recovery Services. And I'll hand over to Ian Lorimer to introduce this paper.
Thank you, Convener, and good afternoon to members of the subcommittee. This report seeks approval to accept just under £100,000 worth of funding for Phase 3 of Digital Lifelines, and also asks the committee to delegate authority to the Chief Officer of the Angus Health and Social Care Partnership to deliver the detail of that. It's back before the committee. It's before the committee because of an urgency. This is money for the current financial year, and need to get on and get that money spent in the current financial year. I'm joined by colleagues Karen Melville and Maureen McGinley from the partnership. I'll pass over to Karen for any additional information she wants to pass on in relation to the proposals in the report. Thank you, Convener.
Okay, thanks very much. Over to yourself, Karen, and we've got your colleague Maureen McGinley online as well.
Okay. Thank you, Chair, and thank you, Ian, for allowing us to come along and present this paper today. I think the background is already in the paper. Angus was really successful during Phase 2 of the Digital Lifelines rollout and has been chosen as one of only 2 local authority areas in Scotland to take forward Phase 3, which is what this funding is for. I think Maureen will be able to talk more confidently about the outcomes for service users around Phase 2 of the project and the importance of rolling out Phase 3. I think all of the information is in the paper in front of you today. I don't really have any more to add to the background, but I'm sure Maureen will be able to answer any questions around the service user experience and how it's helped people connect better to recovery services across Angus. Thank you.
Okay, thanks for that. Do you want to add something now, Maureen, to what Karen has said?
Just to say that I'm really pleased to be part of this project and representing Angus for those in our communities that are digitally isolated.
Okay, thanks for that. So really just open it up now to any questions from elected members. I've got Councillor Bell in the chamber who's got a question.
Thank you very much, and thank you, Karen and Maureen, for bringing this to us. It's really important, and I'm pleased that we've had such success with Phase 2. I wondered if you would be able to tell me how many women were supported in Phase 1. As this paper says, there's a target towards women, and there's a lot of research around why that needs to be, so I totally support that. And would referrals be possibly coming through Glen Clover Project, Glen Isla and Women's Aid? Thanks.
Hi, thank you for the question. Just to say that wasn't recorded, it wasn't a requirement for Phase 2. However, that is what we'll be recording for Phase 3, and there is a focus on women, and we hope that all services will be able to refer into the service yeah.
Okay, thank you. Any other questions from anyone? Okay, don't see any questions. Any comments? Okay, well, Councillor Meakin.
Thank you, Convener. Can you hear me okay?
Yeah, loud and clear, George. Yeah.
Thank you. Just to say that this is clearly a good news story. £100,000 in grant funding is clearly welcome, and hopefully this will continue to support individuals that badly need the support. So I welcome it. Thank you.
Okay, thank you for that. Any other comments? Okay, I don't see any other comments. Okay, so we're asked today 2 recommendations to approve the acceptance of the 36.822k allowance and to delegate authority to the Chief Officer of the Health and Social Care Partnership to spend it. We agreed to that?
Agreed.
Okay, agreed. Okay, thanks for your attendance today and have a good day. Thank you.
Thank you,
Can you stop
Convener.
the live stream, please?